Vital statistics includes all except true answer migration, false answer birth, death, morbidity, marriage. Following are the steps of management process: true answer planning, communicating, organizing, false answer networking, heading. Steps such as planning, organizing, communicating, monitoring, controlling. Health promotion interventions are true answer health education, lifestyle modification, environmental modification, false answer health communication, disease prevention. Live vaccines include true answer BCG measles vaccine, oral polio vaccine, false answer rabies vaccine, tetanus toxoid. Most common causes of mortality of children in Bangladesh are true answer diarrheal disease, ARI, anti-rabies ARI, diarrheal disease, ARI, acute respiratory infection, accidents, congenital anomalies, tetanus. Examples of tertiary prevention is to answer early physiotherapy to an affected limb, laser therapy to prevent blindness in diabetes mellitus, false answer vaccination against rabies, early treatment of persons with infectious disease, environmental sanitation. Auditory aids for communicable includes auditory aids for communication includes to answer radio, telephone, false answer books, newspaper, poster. Incidence of a disease to answer includes new cases only in numerator, needs time specification. Includes new cases only in numerator, needs time specification, can be applied only for endemic diseases. False answer includes old cases only in numerator, includes both old and new cases in numerator. Biological properties of disease agent are true answer infectivity, pathogenicity, virulence, false answer toxicity, autoresis. Incidence of a disease to answer includes new cases only in numerator, needs time specification, or can be applied only for endemic diseases. False answer includes old cases only in numerator, includes both old and new cases in numerator. Proteins are composed of true answer carbon, oxygen, nitrogen, false answer iodine, glycerol. CNO দিয়ে মনে রাখা যায়। Aedes mosquito transmit to answer chikungunya fever, dengue fever, yellow fever, false answer Bancroftian filariasis, Japanese encephalitis. For estimation of MMR, following data are required to answer number of maternal death due to complication of pregnancy, number of live births, false answer number of pregnant women, number of deliveries, number of women in reproductive age. MMR total number of female deaths due to complication of pregnancy, childbirth, or within 6 weeks of delivery from puerperal causes in an area during a given year by total number of live births in the same area in that year into 1000. The following foods have the highest energy value to answer butter, margarine, false answer potato bread meat. The following are the methods of data presentation to answer bar diagram, histogram, frequency polygon, false answer standard, normal distribution, case report. Sources of primary demographic data are to answer population census, record of vital statistics, report of demographic and social report of demographic and social survey published demographic yearbooks. Population census, record of vital population census, record of vital statistics, report of demographic and social survey published demographic yearbooks, false answer published journals. Hospital waste can be disposed by to answer dumping, incineration, burning, false answer composting, manure pits. Population এটা হচ্ছে ডেমোগ্রাফিক ডাটা হচ্ছে পপুলেশন সেন্সাস, ন্যাশনাল স্যাম্পল সার্ভে, রেজিস্ট্রেশন অফ ভাইটাল ইভেন্ট, অ্যাডহক ডেমোগ্রাফিক স্টাডিজ দিয়ে পাওয়া যায়। এক্সাম্পলস অফ এক্সপেরিমেন্টাল স্টাডিজ আর টু আনসার আরসিটি ফিল্ড ট্রায়াল, ফলস আনসার ক্রস সেকশনাল স্টাডি, কোহোর্ট স্টাডি, কেস রিপোর্ট স্টাডি। Passive immunization is useful in the following infections to answer hepatitis B, rabies, false answer hepatitis E, typhoid fever, tuberculosis. Mosquito transmit the following diseases to answer dengue, malaria, yellow fever, false answer schistosomiasis, leishmaniasis. The following diseases can be prevented by pentavalent vaccine to answer pertussis, tetanus, false answer pneumonia, hepatitis C, anthrax. Deficiency of vitamin D causes to answer rickets, false answer rare ophthalmia, angular stomatitis, anemia. Deficiency of vitamin D causes rickets, আচ্ছা the true answer হবে deficiency of vitamin D causes true answer rickets, false answer xerophthalmia, angular stomatitis, osteomyelitis is anemia. Following are the natural disasters, true answer cyclone, earthquake, flood. Cyclone, earthquake, flood, false answer nuclear accident, famine. Health determinants are true answer income, age, education, false answer employment, genetic. Determinants of health: biological, behavioral and socio-cultural condition, environment, socio-economic condition, health service, aging of the population, gender, other factor, food and agriculture, education, industry, social welfare, rural involvement, rural development. Sexually transmitted diseases are syphilis, gonorrhea, false answer scabies, tuberculosis, yellow fever. Primary healthcare services are mainly provided from true answer Upazila Health Complex, Community Clinic, Union Health Sub-Center, false answer District Hospital, Medical College Hospital. High risk population for diabetes mellitus, true answer persons having diabetes in their family, people who eat more but do not do physical work. False answer people who are not fully vaccinated, people who do excessive physical work, people suffering from repeated infection. Disease control program in Bangladesh, true answer Kala Jar control program, malaria control program, tuberculosis control program, false answer yellow fever control program, enteric fever control program. Essential amino acid is present in true answer meat, milk, egg, vegetables, false answer fruits. HIV/AIDS spreads through true answer blood and blood products, blood and blood products, unsafe sex, injection, false answer classroom activities, overcrowding. Secondary prevention can be done by true answer early diagnosis, adequate treatment, false answer specific protection, disability limitation, health promotion. Probability sampling techniques are true answer systemic random cluster sampling, false answer quota, convenient, stratified, purposive. Prevalence increases if true answer incidence increases, recovery decreases. Case prevalence increases if incidence increases, recovery decreases. False answer case fatality increases, diagnostic facilities improve, shorter duration of disease. Obesity is a health hazard that increases the risk of developing true answer hypertension, diabetes, heart disease, false answer tuberculosis, measles. Give the correct information about World Health Organization. True answer formal existence of WHO came on 7 April 1948. WHO has 198 members. WHO consists of 3 principal organs. False answer WHO divided into 8 regions globally. WHO has responsibilities on 8 board area of health. আচ্ছা এর কি আছে 3টা প্রিন্সিপাল অর্গান আছে এটা হচ্ছে বার্থ হচ্ছে 1945 সালে এপ্রিল মাসে 1945-এ আর মেম্বার হচ্ছে কয়জন 190 জন মেম্বার আর দুইটা হচ্ছে 190 জন মেম্বার আর হচ্ছে দুইটা অ্যাসোসিয়েট মেম্বার এই আচ্ছা 3টা প্রিন্সিপাল অর্গান এপ্রিল 1945 আর হচ্ছে 190টা মানে 192টা 192টা মেম্বার. The following occupations have been associated with high risks of cancer. True answer coal mine, tobacco industry, false answer nickel worker, asbestos worker, beryllium worker. Absolute contraindication of oral contraceptive are true answer liver disease, cardiac abnormality, abnormal uterine bleeding, false answer migraine, diabetes mellitus. Hospital acquired infections are true answer cross infection, nosocomial infection, false answer waterborne diseases, contagious diseases, opportunistic infection. Variable is defined as any characteristics or measurement that can take up to answer different values for different individuals, different value for same individual, false answer different value for different places, same value for different individuals, same value for the same individual. Variable হচ্ছে যে is a characteristics or attribute of a person, object or phenomenon that can take different values. Features of chronic diseases include true answer long latent period, prevention demands mixed intervention, false answer duration more than 2 months, definite onset, agents are known. Greenhouse gases include carbon dioxide, methane, false answer water vapor, nitrogen, oxygen. Resources of vitamin A, ripe papaya, green papaya, carrot, false answer guava, egg yolk. MTG have 8 goals, 3 goals are directly health related, false answer 50টা ইন্ডিকেটর, 18টা টার্গেট, নো রোড ম্যাপ. Healthcare delivery indicators are to answer population bed ratio, doctor nurse ratio, false answer per capita GNP, bed occupancy rate, literacy rate. So doctor population ratio, doctor nurse ratio, population bed ratio, population per health center or sub-center, population per traditional birth attendant. Measles vaccine may be given at the age of 2 months, 3 months, 12 months. False answer 6 weeks, 9 months, 6 months. Oral rehydration salt contains to answer sodium chloride, potassium chloride, sodium bicarbonate. False answer calcium chloride, calcium bicarbonate. ওআরএসের ভিতর কী কী থাকে এগুলো সোডিয়াম ক্লোরাইড, পটাশিয়াম ক্লোরাইড, সোডিয়াম সাইট্রেট, গ্লুকোজ ওয়াটার। আর কী কী থাকে সোডিয়াম ক্লোরাইড, পটাশিয়াম ক্লোরাইড, NaCO3, গ্লুকোজ ওয়াটার। একটা থাকে সাইট্রেট, একটা থাকে HCO3 সলিউশন। ন্যাশনাল এনজিওস আর টু আনসার ব্র্যাক প্রশিক্ষা, ফলস আনসার কেয়ার, মাইডাস, হেলেন কেলার। ব্যারিয়ার অফ কমিউনিকেশন টু আনসার কালচারাল বিলিভ, অ্যাটিটিউড, এনভায়রনমেন্টাল, ফিজিক্যাল। Which of the following are micronutrients? True answer vitamin C, iron, calcium. False answer carbohydrate, fat. Following are the healthcare delivery indicators. True answer doctor population ratio, doctor nurse ratio, number of trained traditional birth attendants. False answer rate of population increase, the per capita calorie availability. Routes of direct roots of direct disease transmission are roots of direct disease transmission are to answer droplet infection, droplet infection, transplacental transmission, inoculation into skin. False answer fomite borne, airborne transmission. Indirect mode of disease transmission are to answer vector borne, droplet nuclei. False answer droplet infection, transplacental contact with soil. Morbidity measurement tools include to answer incidence rate. False answer attack rate, case fatality rate, child woman ratio, crude death rate. Most common cause of nutritional anemia. To answer folate deficiency, iron deficiency, vitamin B12 deficiency. False answer vitamin A deficiency, vitamin D deficiency. C.A. Winslow defined public health in 1920 as to answer science and art promoting health, prolonging life. False answer science and art of curating disease, organized general effort for the sanitation of urban areas. Houseflies transmit to answer trachoma, anthrax, poliomyelitis. False answer Japanese encephalitis, chikungunya fever. Houseflies transmit cholera, diarrhea, dysentery, gastroenteritis, amoebiasis, typhoid, paratyphoid fever, helminthic infestation, poliomyelitis, conjunctivitis, trachoma, anthrax, EOS. The principles of primary health care are to answer equitable distribution of resources, intersectoral collaboration, community participation. False answer equal distribution of resources is expanded program on immunization. Equitable distribution of resources দুইবার দেওয়া আছে. Equitable distribution of resources, intersectoral collaboration, community participation. And examples of emerging communicable diseases are to answer bird flu, swine flu. False answer anthrax, hepatitis B, malaria. Emerging রোগ হচ্ছে এইডস, ইবোলা, মার্স, সার্স, এভিয়ান ইনফ্লুয়েঞ্জা, চিকুনগুনিয়া, নিপা, মারবার্গ. Winning foods are to answer rice and pulse, vegetables, egg. False answer dry fish. Dry fish, dry fruits. Elements of communication are to answer source, channel, receiver, audience. False answer decoding. Communication process, a sender receiver message, channel, feedback. In calculating prevalence of a disease, to answer needs time specification. Numerator includes both old and new cases. False answer numerator includes new cases only, numerator includes old cases only. Denominator is the total population. Denominator the population to which the events are related. So denominator is the total population. এখানে denominator কি estimated population at the same point of time. Estimated an interval population at risk. Adult dietary energy resources are to answer carbohydrate have a calorie value of 4 kilocalorie per gram. Linoleic and linolenic acids are essential fatty acids. Protein provides 4 kilocalorie per gram and all 9 essential acids. False answer fats have a calorie value of 5 kilocalorie per fats have a calorie value of 5 kilocalorie per gram. Sucrose, lactose and maltose are monosaccharide. The following are waterborne diseases. True answer giardiasis. False answer kala-jar, poliomyelitis, dengue, Boyle's disease. The major killer diseases are to answer myocardial infarction, stroke, cancer. False answer diabetes mellitus, panic attack. Measures of central tendency are to answer mean mode. False answer mean deviation, standard error, quartile range. Mean mode. False answer mean deviation, standard error, quartile range. The following are the quantitative data collection techniques. To answer in-depth interview, observation, checklist, self-administered questionnaire. False answer focus group discussion. Superiority of breast milk over cow milk are to answer breast milk is free of contamination, contains more iron, easily digestible, nutritional value is more in breast milk, protein is more in breast milk. Effective media for mass communication to answer leaflet, poster, radio, newspaper, folk song. Individual personal contact or interview, home visit, personal letter, group approach, lecture, demonstration. Discussion method: group discussion, panel discussion, symposium, workshop, conference, seminar, role play, mass communication, television, radio, internet, newspaper, printed material, direct mailing, poster, billboard, health museum, exhibition and health museum and exhibition, folk media. Only visual aids includes the following to answer: flip chart, poster, blackboard. False answer television, microphone. Criteria of a disease to be screened: natural history known, high burden of the disease in the community, effective treatment available. Natural history known, high burden of the disease in the community, effective treatment available. False answer low burden of disease in the community, diagnostic tool not easily available. Uses of screening are to answer case detection, control of disease, research purpose. Case detection, control of disease, research purpose. False answer evolution of program, epidemic detection. Use of screening, case detection, control of disease, research purpose, educational opportunities. Biological indicators of water pollution are to answer coliform organism. False answer P. streptococcus, entomoeba, histolytica, Cl. perfringens, Shigella shonei. Non-communicable diseases are to answer diabetes mellitus, malnutrition, schizophrenia. False answer AIDS, STI. The main indications for artificial feeding are to answer mother suffering from fever and diarrhea, prolonged illness of the mother and failure of breast milk, phenylketonuria of the baby. False answer diabetic and hypertensive mother, syphilitic mother. Which of the following are good source of iron? To answer milk, liver. False answer coriander leaf, blackberry, apple. The following are the sensitive indicators of family planning achievement. False answer growth rate, general fertility rate, total fertility rate, birth rate, abortion rate. Characteristics of true experimental studies are to answer manipulation, randomization, control. False answer hypothesis formulation, measuring prevalence. Factors to be considered for selection of insecticide are to answer all answer are false: effectiveness, manufacture point, cost, residual effect, toxicity. Vitamin A is needed for to answer normal skin, normal vision, brain development, growth. False answer prevention of scurvy. High fertility rate in Bangladesh is due to answer early age at marriage, low rate of literacy, poor level of living. False answer poor health facilities, high population density. Toxin mediated food poisoning are due to answer Staphylococcus aureus, Clostridium perfringens, Clostridium botulinum. False answer Salmonella spp, Campylobacter jejuni. The following are the disease for which EPI vaccines are given. To answer tuberculosis, hepatitis B. False answer typhoid fever, hepatitis A, tetanus. The following methods are two-way communication. To answer symposium, group discussion, panel discussion. False answer lecture, seminar.